Assalamu alaikum. Hello everyone. Welcome to my channel, Expression English with Shanaz. If you're serious about learning English, then subscribe to my channel and hit the bell icon to get regular notifications. Also follow my Facebook page, Speak Easy English with Shanaz, for instant worksheets and activities. Today, I have planned to do a different topic with no worksheets and no writing, yet easy. Let's discuss another segment of our training module, speaking. Now let us see what are the benefits of speaking. Speaking helps you to increase in your career advancement. It boosts your confidence, critical thinking, personal development, improve communication skills, make new social connections, personal satisfaction, and expand your professional work. Speaking skills gives us the ability to communicate effectively. These skills allow the speaker to convey his message in a passionate, thoughtful, and convincing manner. Speaking skills also help to assure that one won't be misunderstood by those who are listening. Speak up. Start by telling your friend what you have noticed and why it concerns you. Choose a comfortable, familiar, but private place where the two of you can talk and not be interrupted. Let your friend share as much or as little as they want to. Make it clear that you don't blame them for their problems. Be non judgmental. Try not to assume you know what's wrong. Don't try to diagnose or second guess their thoughts or feelings. Just be there, listen, and offer support. Ask questions to help you both have a better understanding about what they are going through. Assure your friend they don't have to answer any questions that make them feel uncomfortable. Before writing any speech, selecting the right speech topic can be painful, drawn out, and a tedious process. The good news is that it does not have to be. With our channel, Expression English with Shanaz, I'll be able to explain you 7 steps. First, identify the nature of the speaking event and purpose behind it. Second, know your audience. Third, think of your personal interest, knowledge, and experiences. 4. Identify any relevant latest news. 5. Brainstorm all possible ideas. 6. Make a short list of possible topics. 7. Make a decision and commit to it. Picking the right topic means it needs to be done relevant. Relevance means it needs to be current. Has there has been an explosion of media on a particular topic that is of interest to both of you and your audience? If yes, doing some high level research at this point can assist greatly in identifying relevant topics that are at front end of the minds of those in the audience and that you find interesting. During this research process, it could be that you may not identify an overarching topic and you may simply stumble over supporting facts, stories, ideas that assist in driving the topic selection process. Now, for today's session, I have selected novel coronavirus as my topic, or COVID-19. Let's get into the topic now. Severe acute respiratory syndrome related coronavirus is a species of coronavirus that infects humans, bats, and certain other mammals. It is an enveloped positive sense single-stranded RNA virus that enters its host cell by binding to the ACE2 receptor. COVID-19, the illness caused by the coronavirus, starts with droplets from an infected person's cough, sneeze, or breath. They could be in the air or on a surface that you touch before touching your eyes, nose, or mouth. That gives us the virus a passage to the mucous membranes in your throat. Within 14 days, your immune system may respond with eagerly symptoms like a sore throat, a fever, or a dry cough. The virus moves down your respiratory tract, that the airways that includes your mouth, nose, throat, and the lungs. Your lower airways have more ACE2 receptors than the rest of your respiratory tract, so COVID-19 is more likely to go deeper than viruses like the common cold. Your lungs might become inflamed, making it tough for you to breathe. This can lead to pneumonia, an infection of the tiny air sacs called alveoli inside your lungs, where your blood exchanges oxygen and carbon dioxide. If your doctor does a CT scan of your chest, they will probably see shadows or patchy areas called ground glass opacity. Let's see what other organs are affected by COVID-19. Some people who have COVID-19 report symptoms involving their nose and mouth, eyes, stomach and intestines, liver. Let's see how the coronavirus disease spread. The new coronavirus is a respiratory virus which spreads primarily through droplets generated when an infected person coughs or sneezes, or through droplets of saliva or discharge from the nose. To protect yourself, clean your hands frequently with an alcohol-based hand rub or wash them with soap and water. Let's see who is most at risk for the coronavirus disease. People of all ages can be infected by the new coronavirus 2019. Older people and people with pre-existing medical conditions such as asthma, diabetes, heart disease appear to be more vulnerable to becoming severely ill with the virus. World Health Organization advises people of all ages to take steps to protect themselves from the virus, for example, by following good hand hygiene and good respiratory hygiene. This is a new virus and we don't know children or pregnant women. We know it is possible for people of any age to be infected and transmit the virus, although older people and or those with pre-existing medical conditions seem more likely to develop serious illness. Children may be disproportionately affected by measures taken to control the outbreak, such as school closures and physical distancing measures. Special attention needs to be paid to prevent and minimize negative consequences for children as much as possible. Let's see what should you do if your child has symptoms of COVID-19. Seek medical attention, but remember that it's flu season in the northern hemisphere and symptoms of COVID-19 such as cough or fever can be similar to those of the flu or the common cold, which are a lot more frequent. Continue to follow good hand and respiratory hygiene practice like regular hand washing and keep your child up to date with vaccinations so that your child is protected against other viruses and bacteria causing diseases. As with the other respiratory infections like the flu, seek early care if you or your child are having symptoms and try to avoid going to public places such as workplace, schools, or public transport to prevent it spreading to others. Now let's start with basic definitions. An epidemic. An epidemic is a disease that affects a large number of people within a community, population, or region. A pandemic. A pandemic is an epidemic that spread over multiple countries or continents. Endemic. Endemic is something that belongs to a particular people or country. Endemic outbreak. An outbreak is a greater than anticipated increase in the number of endemic cases. It can also be a single case in a new area. If it's not quickly controlled, an outbreak can become an epidemic. Let's see epidemic versus pandemic. A simple way to know the difference between an epidemic and a pandemic. A pandemic has a passport. A pandemic is an epidemic that travels. Now let's see when to use a mask. If you're healthy, you need to wear a mask only if you're taking care of a person with a suspected 2019 coronavirus infection. Wear a mask if you're coughing or sneezing. Masks are effective only when used in combination with frequent hand cleaning with alcohol-based hand rub or soap and water. If you wear a mask, then you must know how to use it and dispose properly. Let's see when and how to wear medical mask to protect against coronavirus. Before putting on a mask, clean hands with alcohol-based hand rub or soap and water. Cover mouth and nose with mask and make sure that there are no gaps between your face and the mask. Avoid touching the mask while using it. If you do, clean your hands with alcohol-based hand rub or soap and water. Replace the mask with a new one as soon as it's damp and do not reuse single-use mask. To remove the mask, remove it from behind. Do not touch the front of mask. Discard immediately in a closed bin. Clean hands with alcohol-based hand rub or soap and water. Last step. Now let us see what is social distancing. Social distancing measures are steps you can take to reduce social interaction between people. This will help reduce the transmission of coronavirus COVID-19. They are to avoid contact with someone who is displaying symptoms of coronavirus COVID-19. These symptoms include high temperature or new and continuous cough. Avoid non-essential use of public transport when possible. Work from home where possible. Your employer should support you to do this. And avoid large and small gatherings in public spaces. Nothing that pubs, restaurants, leisure centers, and similar venues are currently shut as infections spread easily in closed spaces where people gather together. Avoid gathering with people. Use friends and family. Keep in touch using remote technology such as phone, internet, and social media. Use telephone or online service to contact your GP or other essential services. Of a huge thanks to the heroes on the front line of the coronavirus pandemic. As the world faces a global pandemic, there are millions of people we all should be thanking the doctors, nurses, and other medical personnel who are on the front line of the war against COVID 19. While many of us are trying to figure out how to stay away from people as much as possible to avoid illness, those of the people who work in clinics, hospitals, and care facilities are the courageous heroes of this worldwide story, knowingly putting themselves at risk to save lives. Now let us see what is coronavirus quarantine. With more than 1,24,330 people infected and 4,900 dead globally due to the novel coronavirus, as on today's date, has caused a global panic. As the novel coronavirus spreads, self-quarantine has become a buzzword as health facilities are overwhelmed with people who have contracted the virus. Doctors say not all patients need intensive care, but all need to be isolated or quarantined. Self-quarantine is the most effective way to contain the spread of virus. People who have traveled recently may not necessarily develop symptoms of a flu for as long as 2 weeks, but they are carriers nevertheless. This is why travelers who may have come in contact with a coronavirus carrier or suspect they have should avoid meeting other people in 2 week window. An isolation period involves individuals or families staying within their homes and avoiding any physical contact with those outside. Quarantine also means not going to work, classes, malls, events, or other social gatherings in this period. The period of 14 days has been suggested by health experts based on estimates. To stop 19 show up after an average of 5 days. Everyone must practice social distancing to slow the spread of coronavirus. One way to slow the spread of this virus is social distancing, and also called physical distancing. The more space between you and the others, the harder it is for the virus to spread. Social distancing in public means people stay at home and only go out if it's absolutely essential. Keep 1.5 meters away from others. Avoid physical greetings such as handshaking, hugs, and kisses. Use tap and go instead of cash. Travel at quiet times and avoid crowds. Avoid public gatherings and at-risk groups like older people. Practice good hygiene. In touch with others. You can still keep in touch with loved ones while you practice social distancing. Use video chats, make phone calls to people you would normally catch up with in person. Use online groups to interact. Chat with neighbors while keeping 1.5 meters apart. Look after your mental health. Let's all have moral social responsibility and follow the guidelines framed by our government. Topic source for my today's topic could be www.who.int/health-topics/coronavirus. Now we have come to the end of today's lesson. If you have not subscribed yet, then press the subscription button, and if you like this video, click thumbs up icon and share with your friends and family. Thank you so much for watching. Meet you in the next lesson. You have a good day.